So measles has taken up a lot of our time, a lot of our koyach. It's become almost a single focus at many of our medical practices. And I want to give you a little bit of a personal perspective. I'll give you a little bit of my story, why I vaccinate. I vaccinate because of what I'll call Torah Simechu. My mother, Aleh Shum, went through the Muschel, 6 years in concentration camp. She got married, she had 5 children very quickly, and she was a non-vaxxer. She was a non-vaxxer because there were no vaccinations. So when I came along, and I was her 6th child, that's just about when vaccinations started. As a matter of fact, she told me that the year that I was born, and we'll announce it publicly, it was 1964, there was an epidemic in the United States. It wasn't measles, it was rubella, German measles. And she described to me the fear of what it was like to be expecting a child as a Holocaust survivor after having lost, I think she mentioned, almost 200 cousins, aunts, uncles, besides her immediate 11 siblings. What it was like to think about bringing a child into the world when there was an epidemic going. And I'll leave it to the doctors to describe what rubella is like. I do remember girls in my class who were born to mothers that had been affected by rubella, and it was not a pretty sight. So when I used to go for shots, it was a very uplifting time for my mother, not for me. I was a little girl, I didn't want to get shot. But my mother used to say, "Siz nicht asam hamovis, siz asam hachayim." That's how she raised me. So I took it, and it was Torah Simechu, and my first few children, I had that little book, and every single time I needed to give a shot, they got a shot. Fast forward, and Refuah Health Center opened, and now I'm a mother of my 5th child. And now I'm starting to hear a little bit, like, there's something called herd immunity. Like 90% of the people are immunized, and if you don't get your shot right away, it's like not the end of the world because these diseases aren't around. And Dr. Varon, I'm going to look straight at you, and I'll remind you how you used to chase after me with a little piece of paper saying, this child is due, and that child is due, and I was what you would call a delayed vaccinator. And I was wrong. Because from 90% immunity, we're now a community that has 60% immunity. So when mumps came to the Refuah Mobile 6 years ago, hundreds and hundreds and hundreds of children got mumps. Even my immunized children got mumps. And when measles came to Refuah on Simchas Torah, I got a knock on my door in Muncie from a doctor saying they just closed down Refuah because there's a case of measles. Did I know that within 4 weeks we would be up to case number 47 with 2 children in the hospital? I didn't think so in Simchas Torah. And I don't want rubella to get here. So I've asked some of the most prominent doctors to please come and educate us so that the rest of you not become what I was, a delayed vaccinator. Let's get back to where we really need to be, and I'll let the doctors give you the reasons why. So without further ado, I'm going to ask Dr. Muschel to come up and join us.
So, yeah, okay. Good evening. I'm Esther Muschel. I'm a pediatrician at Refuah for the past 9 years now, and I've gotten to know quite a few of you. And I'm going to talk tonight, I'm going to start by talking about vaccine-preventable diseases in general, not specifically measles. Dr. Varon's going to take over and discuss the measles specifically. I'm just going to discuss what some of these diseases actually are, because a lot of people nowadays are not familiar with what these diseases are. And I do apologize if anybody's listening over the phone. Some of this is visual. There are some pictures, but we'll see what. Okay, so just a little bit of history about vaccines. Around the 1700s, smallpox was rampant in England. About 20% of the population died of smallpox. And the way vaccines sort of came about was in 1796, there was a scientist by the name of Edward Jenner. Edward Jenner basically made an observation that the milkmaids who were handling the cows did not seem to be affected by smallpox. So what he had a theory that because they were exposed to cows, and the cows had a disease called cowpox, and a lot of the milkmaids contracted this disease called cowpox, which was very, very similar to smallpox, but much, much milder. His theory was that maybe they developed some immunity to smallpox because they had contracted cowpox. So what he did was he actually went ahead and scraped a pustule from a milkmaid who had cowpox, and he injected it into a child. And then 2 weeks later, he went ahead and injected the child with, he injected the child with smallpox, and the child did not become ill from smallpox. So his theory, in fact was correct, that they were not developing smallpox because they had developed an immunity to something very similar, essentially. So I'm going to go through just some of these vaccine-preventable diseases, what these diseases are. So, because we all hear the names, and most people are not familiar at all with what they are. So, diphtheria is an infection caused by, Corynebacterium diphtheriae. Its early symptoms are fever, weakness, sore throat, poor appetite, and then the bacteria produces a toxin that actually causes some of the cells in the airways to die, and people develop what's called pseudomembranes. So they form like swelling in their throat that then can cause obstruction, and people can essentially suffocate and die. All kinds of complications, heart disease, heart complications, nerve complications, muscles, kidneys, but I just wanted to show a picture. This is what these pseudomembranes look like. They develop this sort of gray coating in their throat with lots of swelling that causes obstruction, and ultimately people often will die from diphtheria because of the airway obstruction. This is another child with diphtheria. You can see what's called bull neck, the swelling of the neck. So tetanus is a disease that is caused by a bacteria that can cause, basically, the early symptoms are something called lockjaw. They develop spasms of the muscles of the jaw, and they can't really open the jaw, they can't swallow, and they later develop symptoms like muscle spasms and seizure-like activity. And these are a couple of pictures of a baby and a child who have, tetanus, and they're in spasm. Now, not sure what happened. Okay, so Hib is a vaccine that protects against something called Haemophilus influenza type B. It is not influenza, it's not a flu vaccine, despite the name. It is a bacteria that can cause a lot of very serious infections, like meningitis, can cause brain damage, hearing loss, seizures, pneumonias, serious skin infections, and there's an infection called epiglottitis, which nowadays we barely see because of the success of this vaccine. So epiglottitis was an infection of the epiglottis, which is part of the airway that covers, it's part of the airway, and it covers the trachea, and if that becomes swollen, people essentially can die of suffocation. Sorry again, so these are a couple of pictures of children who have some of the skin infections caused by Haemophilus influenza. So you can see the child on the left has a very significant swelling of her cheek and discoloration, and the child on the right has a periorbital cellulitis caused by this infection. Pertussis. So pertussis, some of you might be familiar with. We have been seeing some pertussis. Pertussis is otherwise known as whooping cough, caused by a bacteria called Bordetella pertussis. Initial symptoms seem mild. They have like typical cold, runny nose, sneezing, cough, low-grade fever, and then the cough becomes much more severe. So they develop essentially fits of coughing. Kids will have coughing to the point where they have coughing attacks, cough, 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 and then they have like a whooping sound at the end, which is why it's called whooping cough. And then patients will actually, babies especially, will turn blue from having these fits of coughing. And complications include pneumonia, seizures, death. And these are a couple of children who are affected by pertussis. You can see how the child on the left is literally working, using their entire body while coughing. Pneumococcal disease, so this is the vaccine that protects against pneumococcal disease is the Prevnar. The bacteria that causes the infection is something called strep pneumoniae. It can cause a whole range of infections, so it's the most common cause of ear infections, but it's also one of the most serious and common causes of pneumonias and meningitis in babies, and blood infections as well. And it's, ultimately complications include brain damage, seizures, hearing loss, death. All of these are very scary illnesses. This is a picture of a brain of somebody who had passed away from pneumococcal disease, and you can see the pus lining the outside of the brain. Polio, So polio is a virus also with a range of illness, can often start with symptoms like fever, sore throat, fatigue, headache, but ultimately a lot of people are familiar with what's called paralytic polio, which thankfully we don't see that much right now, but ultimately can cause paralysis and death. These are a couple of survivors of polio. Sorry. So mumps, lots of you are very familiar with. We had the outbreak a few years ago. Symptoms include fever, respiratory symptoms, parotitis, which is a swelling of what's called the parotid gland. It's one of the salivary glands. It's one of the glands that produces saliva. And they'll get swelling of the cheek and below the cheek, below the jawbone. And complications, people often think of mumps as being a mild illness, but complications include meningitis, can cause what's called orchitis or oophouritis, which is inflammation of some of the reproductive organs, so ultimately can cause infertility and can cause deafness. And this is a child with mumps. Rubella, so this is actually what Mrs. Sternberg had been discussing. Symptoms are generally seem mild: fever, respiratory symptoms, rash. There are some complications like arthritis and encephalitis, which is inflammation of the brain, but the most concerning issue is, of course, congenital rubella syndrome, which is where a mother contracts rubella during pregnancy, and it can cause blindness in the child. It can cause blindness, deafness, heart defects, mental retardation, bone abnormalities, and this in 1964, in fact, to give you an idea of the magnitude of these outbreaks before the development of the vaccine, there was an outbreak in the US that led to greater than 20,000 cases in 1 year of congenital rubella syndrome. That's a baby with congenital rubella syndrome. Varicella, otherwise known as chickenpox, causes the typical symptoms are fever, fatigue, itchy rash, some respiratory symptoms sometimes. But there are complications. People aren't aware. There are complications. People can develop secondary bacterial infections. So infections caused by bacteria on top of the varicella rash. Pneumonias, neurologic complications that can cause inflammation of the brain. And the highest risk of complications is in younger kids, less than a year, and older, and kids over 15 or people with weaker immune systems, and of course, pregnant women. This is a picture of, on the left is standard, varicella rash, a chickenpox rash. On the right is a baby who has a superinfection, a secondary bacterial infection on top of the chickenpox rash. a meningococcal disease. So, sorry. Meningococcal disease is the vaccine that we give to protect against meningococcal disease is the Menactra. That's the vaccine that we're giving to 11-year-olds. The meningococcal disease is caused by a bacteria called Neisseria meningitidis. It's a horrible, horrible illness. There's a big range, again, of illness, but the two most alarming forms of illness are the meningitis and the blood infections, what's called sepsis. Meningococcal meningitis is extremely, extremely dangerous, very rapidly progressing. Many people die of meningococcal meningitis, and sepsis, blood infection from meningococcal disease, something called meningococcemia, is also extremely, extremely dangerous. That's a picture of a leg of a child who has meningococcemia, blood infection. So ultimately, often will die or lose limbs. Measles, that's just a picture of a child with the measles, and Dr. Varon is going to elaborate further. I just want to mention the flu vaccine, just because of the time of year, even though this is not one of the mandatory vaccines. Flu is caused by the influenza virus. Symptoms, include high fever, chills, runny nose, cough, sore throat, achiness. There's a range of symptoms. Complications can be mild, like ear infections and sinusitis, can be very significant. It can cause pneumonias, it can cause death. I just wanted to point out, I had actually looked this up. The Center for Disease Control reports that last year there were 80,000 deaths in the United States from flu-related complications. And the one thing I want to point out is that a lot of times I'll get a parent who comes in and says, I don't know if I want to give the flu shot because it doesn't always protect, it's often not a match. And the way I look at it is, in fact, that is correct, as in the flu shot is based on a prediction. The other vaccines are vaccines that don't change. They're vaccines that are given all the time, and they're the same vaccine. Flu vaccine does change year to year, and it's based on a prediction. There are scientists who are epidemiologists. They look at the numbers, the statistics, and they do some calculations, and they figure out what will be the most likely flu that year. They are often right. They're not always right. That being said, even if it's not a good match, it is actually still considered to cause milder, say if somebody had the flu shot and develops the flu, still considered to cause a milder flu. I mean, it's still helpful in causing a milder flu, and it still helps to prevent the complications. So I still recommend it, whether or not it is a good match. A couple of things before I turn this over to Dr. Varon. I just wanted to address a couple of myths. There is a lot of fear out there and a lot of wrong information about vaccines. I wanted to just address some of the more common ones. So I'm just going to touch on this briefly because I think Dr. Varon will discuss further, but the biggest fear is MMR causes autism. That there have been many, many, many large studies, very, very scientific studies that have shown no connection between the MMR and autism. And in fact, there was one very large study that even the running joke when I was in medical school was that MMR is protective because the group that had the MMR actually had a lower rate of autism than the group that didn't. The second myth is basically that a lot of people are nervous about giving several vaccines at once. So I hear this a lot from parents. So, a lot of people think that it overwhelms the immune system. So the first thing I wanted to say with regard to that is that babies and, children and adults are constantly having some immune reactions. That means that they're constantly producing antibodies to different antigens and exposures. Babies, from the time they are born, from the second they're born, they're exposed to tons and tons of antigens. When they pass through the birth canal and they start breathing, they're colonized by trillions of bacteria. So they're producing immediately immune reactions. Their bodies are constantly making antibodies to viruses and bacteria, and vaccines literally use a tiny, tiny portion of the immune system. So you're really not overwhelming the immune system by any means. Another myth that we hear a lot is that we hear a lot of patients are very concerned about, they feel that it's safer to give the vaccines to space them out, to spread them out, to give one a month, or to give, to spread them out in some alternative schedule. So in fact, there have been studies that also looked at this, and there's no evidence at all that giving the vaccines at a slower rate or spacing them out will cause less side effects. And in fact, all it does is it causes kids who are not fully immune, so you end up with kids who are susceptible to catching measles or whatever it is, and it causes more fear. A child who has to come in every month to get a shot is terrified. My daughter, who I just brought in for, she's 4 years old, I just gave her Pro-Quad, which is the MMR varicella, the Kinrix, the polio and the tetanus, and the flu shot. She had no recollection of what a shot was. She didn't remember because she came in regularly. She got her shots at 2 months, 4 months, 6 months, and she honestly didn't remember what a shot was because she wasn't coming in once a month to get a vaccine. Another myth that we hear a lot is that natural infection is better, like having the disease gives you better immunity than having the shot. And in fact, also studies have looked at this, and it's considered to be giving the equivalent immunity as having the disease itself. And the price to pay for natural infection is all these scary complications like paralysis, death. I mean, these are, I think, obviously a lot more concerning. A couple of other myths. There was a lot of fear about something called thimerosal. Thimerosal is a mercury product that was initially used in some of the vaccines, in production of some of the vaccines. In fact, the mercury that was in some of the vaccines was something called ethyl mercury, not methyl mercury, and they've done massive studies that showed no connection between ethyl mercury and autism, but even so, thimerosal has been removed, and there are no vaccines that are given to children that have thimerosal nowadays. A couple of other myths, so there are other people hear a lot about other preservatives or things that are in the vaccines, such as like aluminum, which is used sometimes as an adjuvant. So it's used to make some of the vaccines more effective. So in fact, some of the vaccines do have aluminum, but there's more aluminum in breast milk than there is in the shots. So that's, to give you an idea, it's negligible and it's not in any way danger. And there's also a couple of vaccines that use formaldehyde in production, but also negligible amount. There's a higher level of that in the blood normally, so it's not a concern at all. And then the one myth that we do also hear a lot of is that the disease rates have dropped because conditions got better. People are, hygiene is better. People are no longer living like they were 150 years ago, very crowded conditions, and conditions have improved, and that's why disease rates went down. So in fact, that is correct, where there are diseases where the rates of disease went down because of improved hygiene, improved conditions, but specifically, so you say, tuberculosis or typhus, those are diseases that definitely have decreased because of improved conditions. But in fact, the only real decrease in the vaccine-preventable illnesses actually occurred after introduction of the vaccines. So in fact, in a couple of countries, like in England, at one point they had tried stopping to give the DTaP, and immediately, and this is fairly recent, so we're not going back to conditions 150 years ago, immediately there was an increase in pertussis. So the key thing here to bear in mind is that when the vaccines rate go down, the rates of illness, rates of disease go up, which is what we're seeing right now with the measles. The one thing I just want to say before I turn this over to Dr. Varon, I just want to say as a mother, and as a doctor, and I've seen the studies, and the way I look at the vaccines is, the vaccines, the information out there, all of the information I'm hearing from patients generally is wrong information. But are there any rare side effects to vaccines? Very, very rare. Less significant side effects. Very, very rare. 1 in millions. I look at it as the risk of giving the vaccine, which is there but really negligible, versus the risk of the disease. I simply look at it as such, and I look at it as I'm doing my part to protect my child. After that, it's not in my hands. That's how I look at it. And I guess I'm going to turn it over to.
Just want to give a round of applause, please, Dr. Muschel. Thank you. It wasn't easy, and your baby fell asleep in the meantime. So, thank you. And Dr. Varon needs no introduction. Anything I'll say will just take away. So, Dr. Varon, it's all yours.
Good evening, ladies. Thank you very much for joining us this evening. Just a brief introduction for those of you who don't know me. I have had the pleasure of working at Refuah for 22 years. I trained in Canada. I went to medical school at University of Toronto, and then I did a 4-year residency in pediatrics at the Montreal Children's Hospital. Before I came to Refuah, I worked in what was considered a very premier practice in New Jersey that was affiliated with Columbia University. So I'm not trying to toot my horn, but I'm well trained, and I went to very high-level schools. Thank you. I love children. I love, I think people know when they see me, when I see my patients. I enjoy working with children. I love my job. I love the kids. I get a kick out of the kids. I love the children at Refuah as much as I love my own family, and I try to take care of the children here as well as I would take care of my own children and my own grandchildren. And as an aside, it's been interesting for me. Sometimes I see a patient and I'll talk to the mother, and we're discussing together whether I maybe should put the child on an antibiotic or not, and then I say, wait, let me just step back, and if this were my child or if this were my grandchild, I go, okay, now I know what the answer is. The answer is the child needs to go on antibiotics. So I really feel I try to care for the patients as much as I would for my own family. Oh, thank you. I believe in vaccines, as I have seen firsthand how they protect my own family and my patients. Every physician I trained with, every physician I work with, not only believes in vaccines, but we give every single vaccine, and we give every vaccine on time. When I was a young mother, and we would compare notes with each other, and I always had to go back to work when my babies were 6 weeks, and my colleagues would say, did your 2-month-old have their shots yet? And maybe my baby was 10 weeks, and I was like, no, not yet. We were very embarrassed. So if you didn't give your 2-month-old her shots at 2 months, at 4 months, at 6 months, you felt a little bit not like a negligent mother. That's a long time ago, but that's how important the pediatricians who were properly trained, that's how important we felt that the vaccines were and the timing of the vaccines were. So let me talk a little bit about the MMR. The MMR is a safe vaccine. It does not cause autism. The original study that caused, I think, a great amount of confusion came out in 1998 in England by a physician who's a surgeon by the name of Andrew Wakefield. It was a very small group of patients that he studied, and he came out with the conclusion that the MMR vaccine caused inflammatory bowel disease, or a type of inflammatory bowel disease that was maybe related to autism and also caused autism. Of course, this caused an immediate uproar. Everybody was shocked. So immediately the traditional medical community started, we all took a step back and said, wow, if this is true, we need to know about it. We need to do something differently. And they started to do much larger studies, because when you do a proper scientific study, you don't study 10 patients, you study 1,000 patients, or at least several hundred patients. And they started to do study after study after study after study, and none of the studies showed a relationship between the MMR and autism. Finally, they went back. The journal that published this article was The Lancet. It's very, very famous. It's like a Bible in medicine. They went back and they analyzed Dr. Wakefield's study, and they saw that some of the information was actually falsified. They did further research, and they discovered the whole study was incorrect, and they did something they'd never done before. They issued a public correction in the Lancet where they retracted the entire article, and they said, we made a mistake by publishing it, it was incorrect, we should have even done our due diligence and done more research. He then lost his license in England because of this, because doctors are not allowed to publish studies and make up numbers. It's not acceptable. He lost his license in England. He moved to the United States. He has no medical license in the United States. And he works in California, and I think he works privately. He probably does, you know, one of these alternate, I don't know, oil. He does oils, massage, I don't know what he does, but he's not a bona fide physician. So in the meantime, what happened in England is they no longer made the MMR mandatory. So what happened? People hardly give MMRs. I believe they give them usually to the teenage girls in England. They don't give many vaccines altogether in England. What happened to the rate of autism now that you got rid of the MMR pretty much in England? Well, the rate of autism just went up, 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 up. Pretty much the same rate that it's going up throughout the world. Autism is quite mysterious. We don't understand what is going on, but it's certainly not related to the MMR. You get rid of the MMR, nothing happened with the incidence of autism. Recent studies have shown that in many patients that have autism, you can go back and you can look at prenatal ultrasounds and you will see that these children, their brains are a little bit different. In other words, there's something that's happening to the baby already in the pregnancy that causes autism, and it occurs with or without the MMR. It has nothing to do with the MMR. We initially gave one vaccine, and then we discovered in the outbreak of 1991, and some of you may remember, there was a big outbreak in the United States between 1989 and 91, and they even took the girls, I believe the mothers have told me, they took the girls in New Square and they were giving the MMRs in the schools. So that was back in a really, really huge outbreak. And that's when they discovered that one was not enough. So what they realized is that you need a second dose of MMR. It's not a booster. It's not because the first dose worked and then it wore off. It's that for a certain percentage, probably 5 in 100 people, the first dose just doesn't work at all. So you give a second dose, and you hope the second dose works. Nothing's 100% with any vaccines. And it generally thought that if you give 2 vaccines, it's going to be 97% protective. We're thinking probably 95 to 97% protective. That means if 100 kids get 2 MMRs, 3 to 5 of those kids can still get measles. Thankfully, if you have 2 MMRs, you're going to have a very mild case of measles. You might even have no fever, and you're going to be very minimally contagious. So that's the good news. The bad news is it's not 100%, but no vaccines are 100%. I think your husband's here to pick up your daughter. So knowing that, and the fully vaccinated Dr. Muschel's baby is going home to sleep. So, right, she's a big girl. She's a big girl. So, in light of what's going on right now in the community, some of you know that so normally you give the first vaccine between 12 to 15 months. Knowing that the first one didn't always work, we said, okay, you need a second vaccine. We picked the age of 4 because children are getting their vaccines for school entry at 4 anyways, before going to preschool. So we said, okay, you give the vaccines to the babies up to 18 months, and then at the age of 4, you'll give the DPT booster and the MMR. So that's why we randomly picked age 4. It wasn't because it works better at age 4. So you now understand, one vaccine doesn't always work, but 2 vaccines have a greater chance of working. You need to space, if you're going to give 2 vaccines, they have to be 28 days apart. So if you have someone who's never been vaccinated and they want to be vaccinated, they want to be fully immune, you get 1 vaccine, 28 days later you get the second vaccine. And that brings me to also what we're doing with the smaller children. So if I have a patient who had their first MMR at 12 months, and now they're 18 months, It's been 6 months, I can give the second vaccine. And I have been encouraging all my patients to do so because the second vaccine works just as well if I give it at 18 months or if I give it at age 4. As a matter of fact, we were looking today, Dr. Lee, one of the pediatricians from Australia, and he was looking at the vaccination schedule in Australia, and there they give the first MMR at 12 months and the second one at 18 months. So you give your first one and you give the second one at 18 months. It works the same as if you were 4 years old. It's not an extra dose, so why not do it? And that way your child has a greater chance of not getting the measles. The next group that we are trying to target are the 6 to 12-month-olds. So if your baby is between 6 and 12 months, they can get an MMR. It is just as safe at that age as it is between the ages of 1 and 4. The problem is it doesn't stay in your system long term. So it's going to protect you. If you have your MMR at 7 months, you're going to be covered till you're 12 months, but it doesn't count for after 12 months. So it is an extra bonus dose, but no increased incidence of side effects, absolutely no problems. So I'd like to tell the story that 4 years ago I went to Mexico and I took my entire extended family, including my firstborn granddaughter and Miriam Tzivia. And Miriam Tzivia was only 8 months old, and I told my daughter, I'm not taking her to an airport in New York City. I'm not taking her to Mexico because there was an outbreak at the time of measles in Europe. So I said, I'm not taking her without the MMR. My daughter was thrilled. My children are very scientifically educated and very pro-vaccines. So I gave my granddaughter her first MMR at 8 months. Then she had her routine MMR at a year, and then lo and behold, there was an outbreak of mumps in Boston where they were living, and so she had her third MMR at 18 months. So by 18 months, she had 3 MMRs, smart as a whip, and healthy little girl. So again, if it's good enough for my grandchild, and I'm worried about my grandchild and would not feel comfortable without them having the MMR, then you have to understand that I believe that I'm doing something that's crucial for your child as well. I wouldn't take any less precaution for your child than I would for my own and for my grandchildren. In 2014, that was one of our more recent measles outbreaks, there were 514 cases of measles in New York State. Of those 500 cases, 80%, 400, had never received a measles vaccine. The rest had 1 vaccine, some had 2 vaccines, and we didn't know the history of the rest. But that's just to say that you have to understand if you're not vaccinated, you have a much greater risk of contracting this illness. Measles is not a simple illness. 1 in 500 people will die from measles, and a much greater chance of dying if you're under 2 years of age. And I think that you probably all heard that unfortunately a baby died in Yerushalayim last Thursday from measles. It was an 18-month-old baby. I'm allowed to say this because I'm going to quote what I read in the Jerusalem Post from the Neturei Karta section in Yerushalayim. Parents were not vaccinated. Parents had both just had measles, and the baby contracted measles. Healthy baby, never vaccinated. Brought to the hospital, and the medical personnel basically said the baby was essentially dead on arrival to the hospital. All right, so that's 1 death. 1 horrible death. Beautiful, healthy, unvaccinated, 18-month-old that had her whole life ahead of her, died from a completely preventable illness. And I think it's just a tragedy. And hopefully I will never be exposed to such things in this community. Other than something as scary as that, measles more commonly causes pneumonia, causes encephalitis, which is an infection in the brain that can lead to brain damage and can lead to seizures. Rarely, it can cause something called SSBE, which is A very sad situation, 7 to 10 years after you have the measles. Perfectly healthy, healing person. It's more common in children under 2. 7 to 10 years later, they start to behave abnormally and they start to deteriorate neurologically. They develop seizures. It's completely untreatable and they deteriorate, they become fully brain damaged and typically die. And you don't hear much about it because it's not happening right now. It's a long-term complication from measles. The last large outbreak of measles was in 1990 in the United States. And 100 people died from measles in the year 1990. Okay, so I told you about the 2 vaccines. The other thing you might have heard about is that babies under 6 months of age cannot get the MMR because it doesn't work. They probably still have a bit of the mother's immunity, and the mother's immunity interacts with the vaccine, and the vaccine just doesn't work. So if a baby less than 6 months has been exposed, we give them what's called the GG shot, and you have to do it within 6 days. Thankfully, there's no complications, but I think if anybody here in this room has had their babies have the GG shots, I'll tell you that Elena and I gave a couple of these shots together, and the only issue with the GG is that you have to use a big needle because you have to get deep in the muscle, and it's thick and it's painful. And it sort of broke our hearts having to do that because I was very happy to protect these babies. I had absolutely no second thoughts about that, but the whole situation was entirely preventable. How would it have been preventable? You heard something referred to tonight as herd immunity. Herd means like a herd of cattle, a herd of human beings. And they've done studies, and if you want measles not to spread in the community, the critical number is 95%. So if there are 100 people in the community, 95 have to give the vaccine. If there are 1,000 people in the community, 950 people have to give the vaccine. And if that happens, and one person comes in on Simchas Torah and has measles, it's likely going to stop there. And it's because the group is protected. If people are counting on their neighbors to give the vaccine so that they themselves are protected, it doesn't seem fair to me. It doesn't seem fair to me that I think that most people, I don't believe that people that don't vaccinate think measles is simple. It's not simple. A baby died last week, all right? So we can't pretend it's an easy illness. So I think that in many situations, people are hopeful that everybody else will vaccinate and that will protect their baby. And I feel that's not fair to my patients. My patients are sitting in the waiting room. They're doing everything they're supposed to do. And if they are inadvertently exposed to these illnesses, nobody's asked them, is it okay with you if I sit next to you and my baby has whooping cough or measles, do you mind? Nobody asks them. They don't realize. I respect that. Maybe it was unintentional. But you are still unintentionally causing harm to another human being without them being aware of it. And that doesn't sit right for me, not as a mother, not as a grandmother, not as a pediatrician. What else? We had a bunch of slides. Rachel, do we need my slides? I don't know. My slides were about myths and how they're untrue. And we can look at them quickly, but I think Dr. Muschel went over them. Obviously, I don't believe that catching measles is better than getting the measles vaccine. Okay, let's go to number 2. Okay, so if you give vaccines, you have to realize we want these vaccines to work. And there's been many studies that have shown that if you give them all together, they work just fine and they don't cause any problems to the children. And the next one. Okay, what was number 3? Okay, so MMR, years ago you could get the MMR in separate components. What happened was they did studies, and that happened, a lot of this happened when the Wakefield study first came out 20 years ago, and mothers were more comfortable if we split it out. I used to do it, I did it for a while, just to make patients feel more secure. And then they discovered that the MMR works better as a grouping. So if you give it as 3 separate vaccines, you actually don't get as good immunity. So the companies stopped producing it. You cannot get it commercially. It doesn't exist, which is why some of you ladies know that sometimes your German measles, you're not immune, and right after you have a baby, they don't give you a rubella shot. They give you an MMR. It's the only way it comes. It's the only way it comes nationwide. They are rare, so need to immunize. Well, obviously not rare. We're in the middle of a wonderful outbreak. Thank you. We'll go to the next one. We discussed that it does not cause autism or bowel disease, the MMR. There was no scientific link. There have been hundreds of studies that have shown that there's no link between the MMR and autism. Giving them separately reduces side effects? Absolutely not. It wasn't tested? Really? Okay. I don't even have, of course it was tested. Okay, we talked about, here's the first dose and the second dose. First dose works 95% of the time, but we know from that outbreak in 1991 that many children had had 1 dose and it just didn't work. So you have to give the second dose. Oh, my son doesn't need protection against German measles and my daughter doesn't need protection against mumps. We are more concerned with mumps in men, but mumps causes significant illness in women. And when we had that last outbreak, we had quite a few women who were sick. I even had a patient who was in the hospital from complications of mumps. And yes, you're right that if men get German measles, it's maybe not that dangerous to the man, but they expose other people. German measles, interestingly, is a pretty mild illness, and you sometimes don't even diagnose it. But if, God forbid, you're pregnant, and thank God that happens to a lot of women in this community, if you are pregnant and you're exposed to German measles, I'm sure you all know that the baby is born small head, retarded, deaf, blind. I mean, we're scared to death of women getting German measles during pregnancy. Okay. Rachel, am I good to go? No, I'm happy to give the floor to Dr. Wertzberger.
Thanks again to Dr. Varon. I just want to assure everyone that there will be a time to pose questions. If you have the index cards, now's the time to write on them, and we'll come around and collect them. But without further ado, Dr. Wertzberger, I'll covet for you to please present to all of us. Thank you.
Thanks so much for those excellent presentations that we heard until now. I'm Dr. Alan Wertzberger, Dr. Shia Wertzberger, pediatrician in Kiryas Yoel. And the reason I'm here at all is because Baruch Hashem, in Kiryas Yoel, so far we haven't had a single case of measles. And there's, as you know, you've heard what's happening in Monsey. It's in Williamsburg. It's in Lakewood. You heard about Eretz Yisrael. You heard about the death there. And the reason we believe is because of the herd immunity that you just heard about. And the reason I'm here to talk about this is to tell you clearly that this is of practical significance. This is not theoretical. This really is the case. And the reason why the herd immunity is as good as it is in Kiryas Yoel is because of the assiduous efforts of the principals and the school systems there, together with myself and the health department there. As of this moment, I've been told that on record, even before the outbreak, the rate of MMR administration among the children in the schools was 93%. And that was even before that. And there were probably some other undocumented cases there where they received vaccine. It's doable, and it's extremely, I don't have to tell you how important this is. I started my practice in 1985, and I have had extensive experience over the years with many outbreaks in Kiryas Yoel. And no one's mentioned yet the publication, but all of you have this where you were sitting. This publication, Zum Gesint, it says in the beginning of it, is a result of our efforts collectively in Kiryas Yoel to educate the community about the importance of maintaining a high level of vaccination. And it's the collective experience of the community and their recollection of the past that has contributed directly to the acceptance of the fact that vaccination prevents disease in Kiryas Yoel. I was there in 1990 when the outbreak that was mentioned earlier began to occur in Kiryas Yoel. And I want to relate to you a little bit about what happened. There was a 3-day yontif, Shavuos, that year. And the first case that we diagnosed occurred in a bocher in the yeshiva on Erev Yontif. The recommendation then was post-exposure to administer an MMR vaccine within 72 hours. We didn't have 72 hours. We had 3 before Yontif. And it was incredible that we pulled it off. There were 600 bochrim in the yeshiva. And together with the health department, who provided the hundreds of doses on an emergency basis, Hatzolah running around with their ambulances, telling everybody that they have to come to my office. And together with the help of Hatzolah, because we couldn't get nurses together on short notice like that, there was a line a block and a half long, and we went right up to this man giving shots, and we did it. And there were no secondary cases among the bochrim. Now, every time another case occurred, subsequently, we had a similar situation where we had to administer hundreds of doses to children in the school systems where these cases occurred. But there we had more time. There we had the 72 hours, and the health department was very helpful in arranging clinics in the schools such that over a 1-month period, 4,000 doses of MMR were administered. We had only 9 cases of measles. I met today the index case in Kiryas Yoel that occurred among the bochrim. I remember it very, very well. I remember very vividly. This bocher was very sick, and I visited him repeatedly over Yontif while I stayed over Yontif in Kiryas Yoel. And he had a very high fever, 105. He couldn't sit up. He could hardly open his eyes. And I kept monitoring his status to see whether he had to go to the hospital. He had difficulty breathing, but it never got to the point that he was hospitalized. He was very sick. And so I asked him about his opinion regarding vaccinating. And needless to say, he said that this is utterly ridiculous, that anybody would consider anything otherwise. Now, there's an issue regarding credibility out there. The doctors are, the Dr. Partei, wie soll ich gesagt, But I want to make it clear, Dr. Rose Varon is very well known here, and I'm known in Kiryas Yoel and elsewhere. And between us, we have 60 years of experience with the measles vaccine. The experience that I just relayed to you, as well as during the mumps outbreak, I won't get into the detail, but we were very active then in administering a third MMR, about 2,000 extra doses then. And neither one of us has seen serious adverse effects from the vaccine. And we are believable characters. Dr. Varon needs no introduction. And I myself, I'm a doctor, but you see what I look like. And I don't just carry the baton of the doctors. I mentioned this here, and this community also. It's probably very familiar with the Metzitza B'Peh situation that was going on at the time. And I was very, very active against the entire medical community, the health department. There were very few doctors on our side, as it were, and I'm not going to go into all the details. It was documented, if you want, in the TED, if you'd like, the unbelievable siyata d'shmaya that we had. But the situation was very similar there, okay? There were people that were Warfing, Steiner, and I myself, I believe that, that there are very few people that have more experience than me with a population that is entirely Metzitza B'Peh, totally. And what they were saying was absurd. And I'm in the business of protecting people against disease, and I saw with my own eyes that this is utterly absurd and ridiculous. And Baruch Hashem, we had siyata d'shmaya then in pursuing what we did in the courts, etc. Unbelievable siyata d'shmaya. And I call it like it is. And in the case of measles, the same is also true. If I'd be seeing a lot of adverse effects from the vaccine, I'd be telling everybody about it and I'd be acting on it. And that's not the case. And the contrary is true. This entire outbreak is totally preventable. And we all know why it's happening. And I think there's somebody to blame for this. We have to know that there's going to be din v'cheshbon on this. I just want to read an ending from the Shloah Kodesh. This is in Shar Oisius, Ois Dalad, Derech Eretz. And he talks about preventing disease in children. And he says like this, and if you don't mind, I'll read and translate. He says, "V'kosav Ramah b'ter Yudei Simen Kuf Yudvav sheyesh livroyach meho'ir kishadever be'ir." A person is supposed to run away from a city when there's a plague in the city. V'yesh lotzeis min ha'ir b'tchilas hadever v'loi b'soifai. A person should run away at the beginning of the outbreak, not at the end. V'kol elu advorim mishum sakana v'shemer nafsha yirchak mehem. This is because of sakana, and a person who's watching himself should distance himself from it. Ad kan. V'chein noegen no'elam. And this has been the derech in Klal Yisrael. Then this is the quotation. That was the quotation from the Ramah. Now the Shloah Kodesh is talking. Vani tomo oidois makas avabuais ketanois ahoyleches benatinoikos hanikra blotted. And I am totally wondrous regarding the outbreaks among children. That's called blotterin, which I believe probably is smallpox. The blotterin refers to blisters, a blistering disease. And you heard initially the story about the smallpox in the 1700s, and how many people died in England as a result of these plagues. Now, he's saying again that he's wondering, Lama ein nizharin lehavriach atinoikos v'lotzeisam in a year. Why don't people run with the kids and take them out of the city? Ubavadai asidim ha'ovois litein din al misois yoinke shadayim shalei chotu ugmulei cholov shalei pashu shemesu b'choy lizeh. There will zicher be a din v'cheshbon for the parents of these children that did not protect these young children that did not do any averis yet. V'lo choshu aviyam leavricham, and the parents did not protect them by running. Al kain kol ish yirei elikim yihi yorei v'choreid al kol tzar shalei tovoi. So therefore, everybody who's a yirei elikim should be a yorei v'choreid on every situation such as this. V'chol elu advorim shehem shmiras haguf hu bechlalo azhara shel hishomer lecha u'shmor nafshecha me'oid. This all goes under the category shmiras haguf for the lav of the azhara of hishomer lecha u'shmor nafshecha me'oid. You should protect yourself greatly. V'hu gam kein miderech eretz lishmor haguf shu tik hanirtik haneshama. This is all part of protecting the guf from the neshama. Kidei sheyeh kisei leneshama. Hashem Yerachem. The Beschäfer soll helfen Taka. Jeder soll sein gesinnt und stark. Und die alle Kinder. And everybody soll sein gesinnt und stark. And everybody should see nachas from all their kids. So die teure Chippe maßem Toivim. Bis der Bias Goyel Tzedek. Beim Herr b'Yemeinu Amen.
Thank you, Dr. Wertzberger. There's nothing more to say after hearing the heartfelt Getreie Werte. If anybody has any questions, we'll be going around now, and you can pass it around, and we'll have the doctors responding to questions. The first question, my baby had the GG at 5 months. Should she get an MMR at 6 months? Thank you, we're really enjoying the program. Dr. Varon, I'll let you answer that one.
So unfortunately, you have to wait at least 5 months and likely 6 months between the GG shot and the MMR. So it's a bit of a quandary that we're put in because, in a sense, those babies, aren't going to be ideally protected later, but we really had no choice because they were very young when they were exposed. That's the answer to the first question.
The next question. I heard people born between 1957 through 1977 are more prone to measles. Why? Dr. Wertzberger, can we ask you?
I can answer. Go ahead. That's easy. I'm born in 1957. So up to January of 1957. So everybody born in 56 and earlier was thought to probably have had the measles. It's not 100%. The studies have shown that you're probably 95% chance of being immune. So what is 95%? It means that you have a 5 out of 100 people born in 56 or earlier, if they didn't have the MMR, they can get measles. And there was one case recently, I think, of such a person. So you're likely to be immune, it's not 100%.
I have a 10-week-old baby and keep myself back from taking him to public places. Is there anything I can do as a prevention?
Well, the first thing you're talking about specifically with that, unfortunately, bar really keeping the child in a bubble. You really, I mean, you can expect now when you go to the supermarket, you might be exposed to the measles. If you go anywhere, you might be, if you go out and you're exposed to somebody with the measles and somebody coughs on you, for the next 2 hours, you can transmit the measles from your droplets that are on you. So, if there's a known exposure, obviously, if the child has been exposed to the measles, the child needs to get the immune globulin, but, really making sure everybody around them is protected. I mean, that's the only thing you can do, and you can try to minimize exposure.
I guess it's back to the olden days when we didn't take babies to weddings. Yeah. Why does an exposed baby need the IG shots? Aren't they immune from their mother?
They are not 100% immune from their mother. And in the olden days, when a woman herself had measles, her immunity that she transferred to the baby was stronger. But now we see that if you are immune to measles because you had your 2 MMRs, you're not transmitting that immunity so well. I'll give you another example. The textbooks all say it's rare to get chickenpox under, 6 months of age, because you get the mother's immunity. Well, that's quite funny, because I can tell you how many patients I've seen in New Square at 3 weeks, at 5 weeks, at 6 weeks, at 8 weeks who catch the chickenpox. So, and that's from mothers who actually had the illness. So the textbooks say there's some coverage, but it's just not enough. And a small baby who gets measles, unfortunately, there's a very high rate of complications and death from measles in younger babies.
This is a question I hear a lot. Why should I give the MMR shot when I hear of so many children that got measles right after getting the shot?
Okay, I'm sorry that I didn't discuss that, because, that's very important. If you've been exposed to measles and you get the shot within 72 hours, there's a good chance it's going to prevent measles, not 100%. And you might have heard of cases where the child maybe got the shot within 48 hours and they still got the measles. We're doing our best because there's a good chance it will protect, but it won't protect. 2 misconceptions that are very important you need to know about. There's a rumor going around that if you give the MMR and you're exposed, it's going to actually bring out the measles. No such thing. If measles is going around and you get the MMR, absolutely nothing negative can happen. You're not going to get the measles automatically. You're not going to get a worse case of measles. The worst thing that can happen is it's not going to protect you. So if you were exposed 10 days ago, you get an MMR now, it's not going to protect you, but you are absolutely not going to get a worse case. So I have mothers come in all the time and they say to me, well, I shouldn't give the MMR now because it's going around. And I said, you're close, but it's the exact opposite. You need to give the MMR now. So that's one misconception. The other misconception, very important, is that pregnant mothers can give the MMR to their children. That's a long, long time ago, 2 generations ago, the grandmothers would say, you can't have the MMR, baby can't have the MMR if you're expecting. If that were the case, we'd have a very hard time giving the MMR to any kids in this community. But it's 100% established. It is perfectly safe. If you're expecting, your child can have an MMR.
And in fact, I'll add to that, that even in certain circumstances where people might have some degree of immune deficiency, so a patient who had a transplant or something like that, family members can get the MMR. In certain cases where somebody's currently getting chemo, they need to discuss with the oncologist, but oftentimes this family members can get the MMR, case by case, but even in cases of immune deficiency, oftentimes family members can get the MMR.
Here's another question. My neighbor had the measles, and one of their siblings came in contact with our 2-month-old on the street. Does she need a GG shot?
The child does not need it. The child did not come in contact with the case of the measles, but that being said, again, you can technically transmit, if, say, somebody has droplets on them, it can't be transmitted within a couple of hours of the exposure. But no, that child, I just want to clarify, so it was a child who, what?
Is a sibling of a child with measles, and the 2-month-old came in contact in the street.
In the street, no, yeah, that child does not need it.
In 2018, 1 in 36 children are autistic. In the 80s, when children only got 3 vaccines, it was 1 in 10,000. How do you make that correlation? I think you spoke a little bit about that.
Okay, I have no idea what one thing has to do with the other. What happened in the 1980s, what's happened between the 1980s and now? Let's talk about the water supply, let's talk about pollution. How come there's so many more children who wheeze? There's tremendous pollutants. I'm sorry, ladies, but let's talk about what your children are eating. They're all eating super snacks that are filled with preservatives and garbage. And why don't we blame super snacks? In the 1980s, children didn't eat pizza wheels. Now children eat pizza wheels and there's more autism. No, you're not allowed. I'm sorry, you have to write it and send up the question. I'm sorry. So there's something in medicine called correlation and cause. Cause means I work at Refuah, and therefore, I'm sorry, I'm a pediatrician, and therefore I look after children. That's cause and effect, let's say. Correlation means I work at Refuah, and I'm 61 years old. In other words, the two things happen at the same time, but one doesn't cause the other. True, true, and unrelated, and that is what has been shown with autism and the MMR. And here comes Dr. Wertzberger.
You all have the publication in front of you. On page 40, there's really detailed information about all the studies that have been done that have refuted any correlation whatsoever between autism and the MMR. And that should really end the issue. It really should end the issue in anybody that's objective about it.
I gave the MMR to my 7-month-old last week, Friday. Is it safe to take him to a wedding on Sunday? I guess part of the question is, how soon does the immunity kick in?
It does take a couple of weeks for the immunity to kick in, but bear in mind that it does, so the incubation period for the measles is in fact longer. That being said, the thing to bear in mind is that there's the 92% immunity from the one vaccine, so it's still not fully protective. So it takes about 2 weeks until the MMR fully kicks in.
My baby had the second MMR last week, and she has fever today. Could there be a connection? Is fever a week after MMR? It's possible. Probable?
Generally, people might get fever about 7 to 10 days after having might get a fever 7 to 10 days after having the MMR. Yes, it definitely possible.
Well, this is interesting. My friend got measles now, and his asthma went away with the measles. Wasn't it worth it?
Dr. Wertzberger, I'll let you in. Dr. Wertzberger.
Wait, we have a new cure for asthma. There you go, that's so brilliant. Okay. Sorry.
So ladies, there are questions and there are answers, and I think some of it we're going to leave for a private time, but I am going to allow Dr. Wertzberger to go home because I know that his time Every minute that he gave us is special. The two doctors here, will you stay for a bit? We'll shut the mics and people can come up and ask you questions individually. I want to thank all of you for coming and hope, Mirz Hashem, that we should never have to do something like this again. We should get together for good occasions and good health. Thank you all.